In the last 2 weeks, a virus has killed 3 people on a cruise ship in the Atlantic Ocean. Passengers from multiple countries have been hospitalized. The CDC has issued a Level 3 emergency response, their highest alert level. The virus is called Hantavirus, and right now millions of people worldwide are searching for answers. In this video, I'm going to tell you exactly what hantavirus is, how it spreads, what the symptoms are, how deadly it really is, and critically, how worried you actually need to be. All backed by the latest data from the WHO, CDC, and peer-reviewed clinical evidence. What is hantavirus? Hantavirus is not new. It was first identified in the early 1990s. But the strain causing the current 2026 outbreak is particularly concerning. According to the WHO, hantaviruses are a group of viruses carried by rodents that can cause severe disease in humans. People usually get infected through contact with infected rodents or their urine, droppings, or saliva. There are 2 main diseases hantavirus causes depending on where in the world you are. In the Americas, hantaviruses can cause hantavirus cardiopulmonary syndrome, a severe respiratory illness with a case fatality rate of up to 50%. In Europe and Asia, hantaviruses cause hemorrhagic fever with renal syndrome. The strain causing the current outbreak is called the Andes virus, and it is the most dangerous known strain of hantavirus. The 2026 cruise ship outbreak. On the 2nd of May 2026, the World Health Organization was notified of a cluster of severe acute respiratory illness among passengers and crew of a cruise ship in the Atlantic Ocean. The ship was carrying 147 passengers and crew. As of the 8th of May 2026, a total of 8 cases, including 3 deaths, have been reported. 6 cases have been laboratory confirmed as hantavirus infections, all identified as Andes virus. The case fatality ratio stands at 38%. The index case. The first infected patient was a Dutch citizen who had gone on a 4-month road trip through Chile, Uruguay, and Argentina before boarding the ship. He presented the first symptoms and is believed to have contracted the virus during that trip. The CDC has classified this outbreak as a Level 3 emergency response and is working to repatriate American passengers to a specialist facility in Nebraska. How does it spread? This is the most important section of this video, because the answer will determine how worried you actually need to be. Most hantavirus strains spread in one way only, through infected rodents, specifically through inhaling dust contaminated with infected rodent droppings, urine, or saliva. The virus does not spread through casual person-to-person contact. However, the Andes virus, confirmed in the 2026 outbreak, is the only known hantavirus with evidence of limited human-to-human transmission. This human-to-human transmission is what makes this outbreak unusual. But it is important to understand the context. Although rare, spread between people has typically required close, prolonged contact with a symptomatic person, including direct physical contact, prolonged time in close or enclosed spaces, and exposure to the infected person's saliva, respiratory secretions, or other body fluids such as kissing or sharing utensils. This is not airborne transmission like COVID-19. You cannot catch it by being in the same room as someone briefly. Signs and symptoms of hantavirus pulmonary syndrome due to Andes virus appear between 4 and 42 days after exposure. The disease progresses in distinct phases. Phase 1, early symptoms: fever, severe muscle aches, especially in the thighs, hips, and back, fatigue, headache, chills, nausea, vomiting, diarrhea, and abdominal pain. These early symptoms look almost identical to flu, which is why it is so dangerous and so frequently missed. Phase 2, cardiopulmonary phase. About half of all patients progress to a cardiopulmonary phase characterized by shortness of breath, cough, rapid heart rate, and hypotension as a consequence of rapidly progressing pulmonary edema. Cardiogenic shock is the main cause of death and may occur within hours of the cardiopulmonary phase beginning. Phase 3. Recovery. Those who survive the cardiopulmonary phase enter a recovery phase. However, difficulties with breathing can persist for up to 2 years. How deadly is it? The numbers are stark and need to be stated clearly. According to the CDC, 38% of people who develop respiratory symptoms from hantavirus pulmonary syndrome may die from the disease. The WHO reports a case fatality rate of up to 50% for hantavirus cardiopulmonary syndrome in the Americas. To put that in context, COVID-19 had a global case fatality rate of approximately 1 to 2%. Seasonal flu is below 0.1%. Hantavirus pulmonary syndrome has a case fatality rate of 38 to 50%. This is an extremely serious disease. However, and this is critical, the WHO has assessed the risk to the global population as low. Why? Because it is not easily transmitted, and outbreaks have historically remained contained. Treatment. Here the clinical data is unambiguous and sobering. There is no specific treatment recommended for hantavirus infection. Early supportive care is critical, even before the diagnosis is confirmed. Patients with suspected hantavirus pulmonary syndrome can deteriorate rapidly, and delayed care reduces the chance of survival. No approved hantavirus vaccine exists in Western countries as of 2026. Treatment is supportive: ICU care, supplemental oxygen, and in severe cases, mechanical ventilation or ECMO. If you suspect exposure, seek medical attention immediately. Do not wait. How to protect yourself. Prevention is everything with hantavirus since there is no treatment or vaccine. CDC recommends ventilate any potentially contaminated space for 30 minutes before entry. Wear rubber gloves and an N95 respirator. Spray droppings with a 10% bleach solution and let sit for 5 minutes. Wipe up. Never dry sweep or vacuum as this aerosolizes the virus. Double bag all waste and disinfect gloves before washing hands. For travelers, avoid contact with wild rodents, their nests or droppings, particularly in rural areas of South America. Hantavirus is a serious and potentially fatal disease. The 2026 cruise ship outbreak is real, confirmed, and being actively monitored by the WHO and CDC. But here is what the evidence tells us. The global risk remains low. This is not a pandemic. It is a contained outbreak being responded to at the highest level by international health authorities. What you should do right now is stay informed, avoid rodent exposure, and if you have recently traveled to South America and developed fever with muscle aches, seek medical attention immediately and mention your travel history. If this video helped you understand what is actually happening with hantavirus, hit subscribe. Every week we publish videos like this one. Real data, real clinical evidence, no panic, no misinformation. Just facts that could save your life or someone you love. Stay safe. Stay informed.